Halitosis is common among people. It causes anxiety and embarrassment to people having it. Studies shows that 1 in 4 people get halitosis on a regular basis. Today we have with us our health expert who will throw more light on halitosis. But before that, watch this.
Bad breath, also known as halitosis, is a common problem that can affect anyone of any age. Most people have short periods of bad breath at some point, and it is estimated that up to 50% of people have persistent bad breath. Also, up to 25% of the population suffer from bad breath on a regular basis in spite of having good physical and oral health and after the elimination of offensive foods and beverages. It can be difficult to know if you have bad breath. In most cases, other people usually notice it first, and they may find it difficult to tell you. How then can you find out if you have bad breath, and how can it be treated? Stay tuned.
Welcome back. With me is Dr. Ernest Opari Enim. He is a resident studying family medicine at Kolebu Teaching Hospital. He is here to throw more light on halitosis. Doctor, you are welcome.
Thank you very much, Stella, for inviting me. It's a privilege to be on the HealthLink show.
Doctor, what is bad breath?
So like you said in your introduction, it's something that's quite common. So to say halitosis refers to an unpleasant or offensive breath that is caused by either something that is related to their mouth or outside their mouth. So basically it's an offensive or unpleasant breath that usually comes from the mouth.
And do we have people who are at risk of getting bad breath?
Yes, so generally, before I get to that part, I must say that there are 3 categories of halitosis or bad breath. So there's a group that have actual halitosis, and then there's another group we call the pseudo halitosis. And then there's a third group we call the halitophobia. I'll take my time to explain. So the actual halitosis, you have 2 types. The pathological halitosis, in which case it is caused by either an infection or something else happening in the mouth or otherwise. But there is what we call physiological halitosis, where the offensive smell or the unpleasant smell is related to things that are, in quote, physiological or normal functioning of the body. For instance, if I woke up out of bed, if I slept for 3 hours, the breath that comes out after waking up will not be pleasant. It doesn't mean that I have halitosis. So those are what we call the physiological halitosis. The other side is when people have a certain inclination that they have bad breath, but yet research and everything, you go through all the tests, you realize that they really don't have. But back to your initial question, the group of people who are at risk of having halitosis, there's no specified group, but of course the groups that are more predisposed, we've mentioned the younger age group where they are unable to, perhaps, especially when they are growing up, take a lot of candies and some get caught up in their teeth, between their gums amongst others. And then the older folks where they may not be able to go through the required routine or technique of brushing their teeth. But I must say that the prevalence or how common halitosis is cuts across board. There's not a specified group of people that present with it, although the classes I presented tend to present it more, either because they are taking a lot of candies that gets not broken down well or digested, or they are older yet they are unable to go through the full motions of brushing their teeth well.
All right. So what's the difference between the pathological halitosis and the physiological halitosis?
So generally, the pathological halitosis, like I said earlier, is that it is caused by usually perhaps an infection or something that you can relate to going wrong in the body. So 80%, up to 80 to about 90% of all halitosis or bad breath is caused by things that are related to the mouth or so to the dentition or the teeth. So you can have a gum infection. When you have a gum infection, we refer to as periodontitis. You can have bad breath. If you have infection of the sinuses, we call sinusitis, you can also get bad breath. But there are some other conditions where it is not just a result of an infection in their mouth, but it's something that is going on in their body entirely. So people with diabetes, when diabetes is uncontrolled, and then their body tends to break down a substance we call ketones, they have what we call ketoacidosis. And then as a result of that breath, their breath is described as acidotic. So they have a smell that is offensive in that way. So there are other causes. Sometimes when you have a liver abnormality of the liver, it can also cause a certain peculiar kind of breath in you. So those are what we call the pathological. But like I said earlier on, when you have a physiological cause, it means that it's not because there's something wrong in the body per se, or there's an infection like I described earlier. So if you wake up from your sleep 3 hours after sleep, you have a smell that is offensive. Or for instance, if you took garlic, you have that kind of breath. And we know that even though it's not normal, it can be directly related to something that you've eaten in a short while, and those cases are not pathological.
So what exactly causes halitosis? So
the causes, again, you have what we call the intraoral causes, and then the extraoral. The intraoral causes account for 80% to 90%. Right. So you have an infection of the gum, the periodontitis, you can have a bleeding gum, a lot of other things that happens in the gum. If you have something stuck in your mouth that has not been washed, as the pathogens or the agent that causes infection in the mouth continue to break it down, as a result of the breakdown of the substances that are left in the teeth, it causes a pathological kind of smell. So that's another cause. And then outside the mouth itself, you can have an infection of the sinuses. The sinuses are around this part, and then we have some around our forehead. So when you have an infection of the sinuses, especially when it's gone on for a long time, which we call the chronic sinusitis, you can have it as well. So these are the common causes of halitosis.
And how will I know that I have halitosis? Because you spoke about the morning one. So what's the difference between that one, and what are the some of the signs and symptoms of halitosis that would differentiate it from the normal morning bad breath?
Yeah, I can imagine it's a difficult question for everybody. Indeed, the difficulty about halitosis is that many a time it is subjective. So you would have to refer to maybe somebody who is a very close friend and has enough confidence in you to tell you that I think your breath is bad. Otherwise, people would usually not consciously smell their breath to be able to tell. But sometimes you will be talking to people, they tend to shy away from you, or it's like when you get into a conversation, people show you some symptoms, or they show some kind of mannerism that tells you that they are uncomfortable with how close you become. Because usually when somebody maintains a conversation about maybe 10 to 15 centimeters apart, usually their breath is supposed to be pleasant. But when you realize that consistently people are shying away from you coming to them, then it may be one of the causes. But having said that one, all of these are subjective. Sometimes we'll do what we call the cup test, the wrist cup test, where you place your hand just to demonstrate. So your hand is like a cup, and then you put it here, and then you exhale or you breathe out air. And then in doing so, because the hand has been, you've put your hand in the form of a cup, you inhale the kind of air that you breathe back, the kind of air that you've exhaled. Or we call there's another test we call the wrist lick test, where you try and lick your wrist. And in so doing, the breath that comes out, you consciously breathe it out. But all of these are subjective. The more objective test we call the organoliptic test. And that one you have to see a doctor or be in a hospital setting for it to be done. So I must admit that generally, diagnosing bad breath is difficult because there are two categories of people. There are people who don't have it but are preoccupied with the thought that they have bad breath. And so they will go to a hospital, they are checked, the tests are done, they don't have it. And the other group who have it but yet will not comfort because they think it's normal. So I agree that it's a very subjective way, but the definitive test we have now, which has a certain level of reliability or accuracy, is what we call the organoliptic test, which can be done in the hospital setting.
And how is it diagnosed in a hospital facility?
So yes, in that case, the patient or this person with a suspected halitosis will be given a test tube to exhale, and then immediately, without diluting it with the environmental air, the doctor would have to sniff the air without the patient knowing. So it's like you are doing it at a certain barrier, and then without the patient knowing, the doctor would or sniff what the patient has exhaled into the test tube, and then there is categorization. So maybe if it's very offensive, it has its grade. If it's not offensive, you have its grade. So in that order. So that is the objective way that it is measured. But aside that one, the ones I described, which are the cupped wrist, wrist or the wrist licking test, are all forms which you can though. But of course, maybe much later into the discussion, we'll talk about the treatment. You don't need to have halitosis before you take some of the steps that we'll discuss much later in the program.
Doctor, I want you to educate us on some of the lifestyle that can cause bad breath.
So yes, indeed, depending on what you eat, you would have a certain breath related to the food substances or drink that you've taken. Okay. So for instance, early on in the discussion, I mentioned garlic. It's not because somebody would have bad breath, but if you took garlic, obviously the breath that comes with garlic after the breakdown will stay in your mouth. So we would advise that if you are somebody who wants to take garlic, then you must be conscious to rinse your mouth continuously, or even brush your teeth if you think that that will be the best for you. About other factors that could lead to it, for instance, somebody taking foods like we have on our market, the momone and then the kobe. I don't think taking those are bad in itself. What matters is that whether or not you have halitosis, certain behavioral changes that we have to adopt is that, first of all, whenever you've taken any kind of food, consciously rinse your mouth, so that you make sure that any debris that is kept between your gum or your teeth are taken away. And also the other habit that we have to cultivate is brushing our teeth twice in a day, morning and then evening. I know people would have questions, should I eat before I brush my teeth? Fine, people have different school of thought. I think that you need to brush your teeth before eating, but regardless, if you want to eat before having breakfast, kindly do that in the morning and then in the evening as well. I will mention later on as we go on the program the technique of brushing your teeth, because many a time somebody would have said they brushed their teeth, but if the technique is wrong, it's really little, it solves a little of the issue in its entirety.
Can alcohol cause halitosis or bad breath?
So alcohol in itself, like any other substance, has its own peculiar smell. So if somebody is intoxicated, that's to say that the person has taken excessive alcohol, or depending on the level of the alcohol that you have, because they are different percentages. So if it's very strong, they may have taken a little, but then it will still remain in their mouth. So that kind of smell will be there. The other thing is that apart from alcohol in itself giving you that kind of peculiar smell, when alcohol is taken for a long time, you are predisposed to having what we call liver changes, which we call cirrhosis. So that kind of changes in the liver also presents with its own breath. So alcohol in itself has a peculiar smell, but if you are taking alcohol persistently and in excess amount, and then it affects your liver and you develop some changes we call cirrhosis, which is the liver undergoing changes, becomes nodular, strong, like very rigid instead of very flexible, then it also presents it with its own breath. So to a certain degree, I must admit that alcohol has a pungent smell, but it doesn't mean everybody who takes alcohol will have bad breath in itself. The underlying thing is the behavioral thing that you asked me early on, that you need to cultivate the habit of brushing your teeth twice in a day, morning, evening, rinsing your mouth, and then flossing. You have this thread that people use just to take out any debris that is caught in between your gum or your teeth.
Doctor, I know that gum bleeding can also cause halitosis or bad breath, and you mentioned earlier that you need to use thread to remove in between your teeth. I want to find out, won't it cause gum bleeding that can also lead to bad breath?
So when I mentioned thread, I was describing the kind of tool that is used in what we call dental flossing. It is thread-like, but it's not the kind of thread that the seamstresses and the tailors use. Okay. So you need to go to the hospital or any pharmacy and ask of a dental floss, which is specially made to be able to remove any things that are stuck between the teeth or the gum, and also it has a certain potential or some properties that allows it to reduce any kind of infection. So using the dental floss, not just any thread, reduces the risk of having bad breath or halitosis. Indeed, bleeding from the gum may not be a direct cause. It may be a symptom of a disease of the gum, which we call the periodontitis. Usually when somebody has an infection of the gum becomes inflamed, and it may become, by inflamed I mean becomes bigger than usual. It becomes swollen, sometimes becomes very painful, and it is easily it's brittle, so it easily bleeds. So by bleeding, even though bleeding is what the person will complain of, usually if you go down and do a thorough examination, you realize that this person may have an infection of the gum rather than just the bleeding in itself. But of course, if the bleeding continues for a long while and is not rinsed, then it can also give you a peculiar smell.
Can dental caries, which is also known as caca in our local language, cause bad breath?
If it continues, yes, it will, because the pathogens will continue breaking down the leftover food or whatever infection is there. And as the infection persists, they have a peculiar smell that they come with. So I agree with you. Dental caries can lead to bad breath.
You are watching HEALTHLINK TV show. We will be right back.
I think when you don't brush your teeth and tooth decay causes bad breath.
Bad breath, I think when you don't brush your teeth on time, and sometimes you don't brush it, I think twice or thrice, as like we all have to do. I think that's causes bad breath.
So nipa no didi, in case like nipa no di meat ana or di bibi, I say like aduane bi or di, I say like pasty. For example, di benko any meat say tent no beba nti obi also on di nti I say like pasty. So one pasty ebe ma onu bed ebe bon.
The food we eat, we know bacteria is the primary cause of such bad breath. So if you eat too much of junk foods, definitely to alternate your saliva and you develop bad breath.
Tell the person in a nice way, maybe get a mouthwash and a toothpaste and you pass on it in a nice way and give it to the person, because I think if you don't tell your friend, you'll be a bad friend. So you being a good friend, you tell the person that, oh, this is your problem, so that's how I can help you. So I think that's it.
Without, it's very awkward to say and very difficult to say. But as friends, you have to keep up for each other and stuff. So just buy a mouthwash, so then just gives you like a person as a present. Then just tell him in a very polite manner.
Okay, I'll tell the person in behind the scenes actually that we are developing bad breath.
So be no kasa, obengu say scent free, nenubo. And mostly omu kasa ebi also yare ne yes auntie. Metumi aka chi madam for same.
Welcome back. We've been discussing bad breath and doctor educated us on the causes and some of the signs and symptoms. Doctor, how can bad breath be treated?
So the treatment of bad breath depends on the cause. Like I said earlier on, majority of the causes are related to mouth. Okay. So if a patient comes with halitosis confirmed by a diagnosis after examination, for instance, if it's due to an infection of the gum, which we call the periodontitis, then an antibiotic will be given, and then the patient will be educated. The preventive part I'll share much later in the program. And then also for somebody who has what we call the recurrent or long-standing sinusitis or infection of the sinuses, then there's also a treatment that is rolled out. So generally the treatment depends on the cause. So in some people, aside the antibiotic provision that is given, you may have to do what we call the restorative surgery, where maybe if you have a dental carie and you have to take it out, then an extraction may be done. And so it's not one fit all. It depends on the cause, and then the doctor will roll out a specified treatment regime for you.
Doctor, so how can bad breath be prevented?
So prevention starts from you not having it at all. We hope that everybody sees a dentist at least. I know it's difficult for most of us, but then at least every 6 months, in which case you would have kept in touch with him or her to be able to advise you whenever you have any changes with your breath. Secondly, taking to good oral hygiene, which includes brushing your teeth twice in a day, early in the morning and then in the evening. I earlier on mentioned the technique. One of the causes of bad breath, which I should have mentioned earlier on, was a coating of the tongue. Sometimes we all brush our teeth and we forget that the tongue is also in the mouth. So if you brush your teeth without brushing your tongue, you are still, if you have bad breath, or even if you don't, you still have a risk of having bad breath. So as part of brushing your teeth, you have to remember to brush your tongue. And then the technique that is known to be efficient in brushing your teeth to ensure that your risk of having dental caries or bad breath is reduced is what we call the modified bars method, where holding your brush, you go round every portion of your teeth. So if you take this part, you go in this circular fashion, and then you come here, you go in this fashion, and then you go into this corner. So you go in a circular fashion with your brush every area of your mouth, and then you go inside, because sometimes people may forget that they need to brush inside their teeth. So you have to brush into the corners on the outside in fashion, round in this way, round in that way, and remember to brush your tongue as well. And then also try and drink more water, because when you are dehydrated, your body tends to break down other forms of other sources of energy, and in so doing you have what we call ketoacidosis. So drinking a lot of water tends to prevent dehydration, as well as also reduce your ability to produce such concentrated smell. And also flossing, I mentioned earlier on. Anytime you take any foods, it doesn't matter the time of the day, not any kind of thread, but getting to a pharmacy or a doctor and then getting your floss and having it done, and rinsing your mouth after each meal is beneficial. So those are things that I would say would help anyone who even doesn't have bad breath, but it will help you prevent it entirely.
Doctor, so people with gum problem, which type of brush do you recommend for them to use to clean their teeth?
Okay, so generally, even without having a gum problem, there is this inclination or tendency of people to go for very hard brush to ensure that they are brushing their teeth. The brush that you use shouldn't be too hard, neither should it be too soft. So it should be somewhere between. Anytime you are using a brush which is too hard, like you said earlier on, you may bleed, it may cause you pain. And if the brush is too brittle, it may presuppose that it's unable to give you the flexibility or ability to kind of clean any kind of any of the teeth that needs enough cleaning. So I'll say that it should neither be too hard nor too soft. It should be somewhere in between. And about people using their mouthwash, indeed, using a mouthwash is part of the or treatment when somebody has halitosis, but it is not a substitute for brushing the teeth. Even when people have issues with their gum, there's a way that they can go about brushing their teeth that would make sure that they still benefit from that without having to injure themselves. So using a mouthwash is good, but it's no substitute for brushing the teeth.
So how can people with dentures brush their teeth?
So one, we mentioned the kind of brush that you are using. It shouldn't be too hard or too soft. The technique I mentioned earlier is the preferred technique with high efficacy. It's the modified Bass method, where you go in a circular fashion, every part on your tongue, outside and then inside. And thirdly, is how you go about it. Having a denture alone doesn't prevent you from brushing your teeth, but if you do it so rigorously, then you stand a risk. So you don't have to do it very strong and that kind of way. It has to do more of the technique than the amount of energy or activity you are putting in.
Doctor, this question is very important to me. Can sweets cause dental caries?
Yes, so sweets in themselves are not bad. I mean, as a child, I used to like sweets myself. So, and most people would take sweets one time or the other. The most important thing is that when the sweets are left in the gum, unintentionally or any part of the tooth, and they are not rinsed, and it's kept there, some pathogens or agents that cause infection will come and enjoy also what you have left, especially when we go to sleep. And as they enjoy what you have left in the gum unintentionally, they tend to break down these substances, which further dissolve the ability of the tooth to maintain its normal architecture or shape. And so when that happens, they leave a bad breath. So indeed, to cut it off initially is to reduce the amount of sweet you are taking. But if you by all means have to take sweet, I won't say don't take any sweet. You make sure that you keep a good oral hygiene, visit the dentist often, brush your teeth, but most importantly, please rinse your mouth with water anytime you take any food, not just sweet. And then also do the flossing to make sure that, assuming you took it and you were unintentionally left some of these food particles or sweet in your teeth or your gum somewhere, they will be taken care of.
Dr. Parry, thank you so much for sharing your knowledge on halitosis with us. We are very grateful for that.
Welcome. Thank you for inviting me as well.
I hope to see you again.
Sure.
Viewers, you have it all. Thank you so much for watching HealthLink TV show. Special thanks to Crown Medical Center for supporting this show. See you same time next week. Until then, always remember that your health is your priority. Bye-bye.
Facts on halitosis: bad breath. Brush teeth twice a day. Floss daily. Brush and scrape your tongue. Use mouth rings. Visit your dentist. Garlic and onions can cause bad breath. Stress can cause bad breath. Quit smoking and avoid tobacco products.